Jim Carr is a Manitoba Liberal MP and Cabinet Special Representative for the Prairies. He's with me now. Minister Carr, good to see you again. Thanks for taking time to speak with me
Good to see you again, too. It's been a while.
Yeah. Can you give us more detail about exactly what help the federal government is going to be sending to Manitoba?
It wants more nurses. It wants transportation, logistics, more vaccinations in First Nations communities, more equipment, more help on the ground. Our system is stretched. We're having to send patients into Ontario, the possibility that some Manitobans will go even to other jurisdictions. The nurses, support staff on the front line, exhausted, and we need the help of the federal government. The Prime Minister has spoken to the Mayor of Winnipeg, Brian Bowman, Premier Pallister on Friday. There has been a formal request for assistance. Governments are working on that now, right. And we will be there for Manitobans as we have from the start of this pandemic. We're going through a very rough time. Peter, there are so many cases in Manitoba now that every family will know someone who has picked up the COVID-19 virus. And that makes it personal. It brings it to the neighborhood. And it's what we're coping with right now. And
let me federal
government.
Sorry, Minister. Let me jump in. Brian Pallister, the Premier's asked for 50 critical care nurses, 20 respiratory therapists, 50 contract tracers, the military to help with vaccine rollout in Indigenous communities. Manitoba officials saying today, look, we've been told we're getting 12 critical care nurses. So is that the start? And should he expect that he's going to get the 50 critical care nurses he's asked for?
There's a serious shortage across the country, as you would well imagine. At this moment, but we will do whatever we can looking at the system and looking at the possibility of other provinces helping. We know that the strains and the stresses are at a critical point, and it's very possible that over the next number of days, it could get worse before it gets better. So we are alert to what the requests are, what the capability is from the Government of Canada, and we're working very closely with Manitoba to make sure that we can provide what they need urgently.
Right. But it sounds like Premier Pallister might not get everything he needs just because you might have trouble scrambling those numbers from any part
we're going to do we're going to do whatever we can, and we understand how serious and urgent the threat is here, and we'll respond in the best way that we can.
Why do you believe the situation has become so acute in your province in Manitoba, to the point, as you've mentioned, where the ICUs are so stretched that they're now sending patients to Ontario, 18 so far? Why is it happening?
Well, we're going to have an awful lot of time to wonder how we could have done things differently during this pandemic. It came quickly. It came powerfully. We responded as best we could as a national government, humble enough to realize that we didn't get it all right the first time. And there will be plenty of time for people to assess what we've done and how we could have done it better. Now is not that time. Now is the time to make sure that the people who are most in need get what they require. And in the case of Manitoba, it's nurses, it's logistics. Right. The vaccines are rolling at a much better rate, and they will continue to. So we know that there is all kinds of good news ahead of it, but we have to double down on our discipline.
Okay, let me ask you about that. Doctors in your province today, a group of doctors calling on the Premier there, Premier Pallister, to introduce tougher measures, including a stay-at-home order, closing of all essential, non-essential businesses. Do you support those doctors in what they're calling for? Do you think the Manitoba Premier has done enough here to crack down on the spread?
The Premier will take his advice from his public health professionals, and that's the way it should be. There is always an easy road looking back to try to second guess what we have done or what we should have done. But again, now it's the time to respond. And the request has gone out to the Government of Canada. We have responded, and this isn't the first time. And as the Prime Minister has said, we will do what it takes for as long as it takes to keep Manitobans and all Canadians safe.
But you're sitting there in Winnipeg, and you're close to the situation. You've watched what's happened in your province. Do you think the Premier's done enough here? Is he following the right kind of There seems to be conflicting advice coming from health experts in that province. Do you wish he was?
Sorry, go ahead.
Yeah, do you wish he was doing more? Are you satisfied as a Manitoban?
I wish the situation was better. I wish that there were fewer people sick. I wish the positivity rate wasn't 15.9%. I wish that we weren't running out of ICU beds, but we are. And when you're living through a crisis and it's fluid and changing every day, the best use of your energy is to work collaboratively across the system, across governments, to get help to the people who need it most as fast as you can.
Some have suggested the federal government should be attaching conditions to help for provinces that get into this kind of trouble. What do you think of that?
Well, I don't know that this would be the time for that. Premier and Mayor have called the Prime Minister and said that we need this help now because our people are suffering because of an inability for us to keep up with the demand in the system. Well, that kind of is a bit of a conversation starter. So what you do is you find the resources where you can find them across the federal system and throughout the provinces, and you come up with what the Manitoba government says with good public advice, public health advice to give people what's needed immediately, and the priority that they have determined is what they need now, and that's what we're doing.
All right. Jim Carr, always good to get your perspective. Thanks for your time tonight, sir. Take care.
You're very welcome.